Good morning, everyone. I'm Natalie. I'm here with Dr. Maryam, the inventor of BLAfit. She's a board certified dentist with so many years of experience specializing in TMJ, sleep apnea, orthodontics. She knows her facial structure like anyone else. She knows it so well, and that is why today we're going to talk about not only face yoga to help improve and enhance your facial features, but also talk about how nutrition specifically can directly affect how your facial structure looks. Which is really interesting. I'm actually really excited to hear about this topic, so I'm ready to learn, and I hope you guys are too.
Good morning, everybody. Thank you, Natalie. I wish you guys had a great weekend. Yes, one of the main factors in facial development is proper nutrition. And proper nutrition starts from when the baby is, we're pregnant and the baby is developing in mother's womb, and we just need to make sure that we pay very good attention at that point not to take processed meals and sugar as part of our cravings. One thing that we learned as our society became more westernized is that in the last, I would say 50 years or so, we've added white flour and white sugar in our daily diet. And since then, our facial development has been really affected by that, because we know those two chemicals, both white flour and white sugar, are processed to become white. Originally they were not white, so that we went through the processing it. I always tell my younger patients that imagine you bleached that that flour that was brown. How did we turn it to become white? It's a process kind of like bleaching your teeth. It's to whiten it, and that creates toxics that our body is capable of recognizing nutritions that are from Mother Earth. When we stimulate and we affect that nutrition to become something different, now we don't recognize it. So our body right away produces acid to be able to digest it. So things like processed sugar or processed flour, which we call it white flour or bleached flour, creates those toxins that our body recognizes and produces acid. So they create an acidic environment. And now we know that acidic environments are very bad for our health and wellness. And when we have those things added, if you're pregnant, so now the baby is eating those toxins. We need proper nutrition for one of the things that creates malocclusion or deformation of facial development is nutrition, right? So now we're not giving the proper nutrition to the baby to grow, we're giving him acid. So now internally there's allergens, there's now those products that are in our westernized world, they actually have allergens, additives, so many different products to be able to keep him on shelf life. So now we're adding that to the baby. So the baby is born already to the world with some sort of allergy and inflammation internally, because we fed him all this processed junk and the fast food type of a diet, which is usually like a place like a McDonald's. Your white flours your bread is made from usually bleached flour. So we're actually think that we're eating nutrition where we're eating actually toxic material in our body. So now the baby is born, we need to learn that we need to breastfeed. Now if we can't breastfeed because we're not properly nutrition and we can't breastfeed, now the babies now have to take bottles, and bottles started a couple of centuries ago when kids couldn't breastfeed, right? In the bottled milk, I promise you that there is lots of processed junk in there. Sugar is one of them. And now we're feeding these kids with a little nipple that is on the bottle, and the tongue placement plays a big important role for that infant to be able to suck the tongue in the palate when they create suction with the mother's breasts. Now the nipples, you don't need to do that much of a hard work to push the tongue in the palate and create that suction. It's easy, so it lazies the facial development, and the tongue doesn't need to be properly positioned in the palate. So the palate becomes underdeveloped, and then you have all these teeth that don't have room to be and crowding. And so the airway collapses because now we have the tongue, instead of being in the palate, in the wrong position, and now we're getting crowded, pushing the lower jaw back, and now we have this cycle of now the kid cannot breathe, now they have to mouth breathe. And when we mouth breathe, we're doing other things to development. So it's just a vicious cycle. So I really believe that our society, if we want to reclaim our health, it has to start with nutrition. And we have to really go into our cabinets in our households and really get rid of things that are packaged, that you read the packaging and you see so many different items. I promise you they cause allergy, they cause mucus formation, there's some that cause cancer, and then with the westernization of white or bleached flour and white sugar added to every product that we eat almost, if you go to a grocery store. So we just need to keep in mind that once we have allergy in our body and we can't breathe through our nasal passageway, we're now mouth breathing, and it's just going to change our whole facial development. So one of the things that we need to learn, as I hope that one day pediatrician, infants that are going to see the pediatrician, is to train the parents to teach the kids the importance of nasal breathing. So one of the things that's learned is to teach the kid, now the young child comes to our practice, teaching them that you need to keep your lips sealed and put the tongue in the palate and breathe through your nose. Nasal breathing, it's another factor that if we teach children, we can kind of normalize the facial development. Because the moment we seal our lips are soft muscles that keeps things intact. If our mouth is open, nothing is holding the movement of the dental dentition, and so the upper incisors, the front teeth, torque out. The tongue is pushing things out to be able to breathe because it's choking. The kid's choking. So teaching the proper nasal breathing and proper chewing patterns that I don't know if any of you parents are telling your children, just take your time and chew. We as parents, me primarily, I eat so fast because we're such a fast-paced life. Now, even if I have the proper nutrition, if I don't chew properly, I'm not using my muscles of mastication properly, and my jaw is not developing correctly. So these are the things that we have to keep in mind: proper nutrition, proper teaching of nasal breathing and lip seal, and proper chewing. Because even if I give my kids nuts and all the wholesome food that I can provide for him, if I don't teach him that you need to sit down and breathe through your nose, seal your lips, and chew slowly, we're not going to be able to benefit from that chewing as a very good facial development. When the upper arch and the lower arch are not developed properly and we're not breathing through our nose, we're growing long faces and malocclusion, which means our teeth are crowded. We have bad tongue habit. Now those same kids, they may have asthma, allergy, and many other skin issues, because now we're just changing the way our whole body mechanism is working. So
right. And so what do you recommend for people that are not mouth breathers by day, but they are during the nighttime?
Well, now we're learning that, the daytime, we have about 12 to 14 hours a day that we can practice that lip seal and breathe through our nose. Now, nighttime, most of us at some point of our sleep, our mouth the muscles becomes really with no tone, and they fall completely asleep, and they lose tenacity. So our mouth opens up. it's a very short part of our sleep pattern, so I'm not that concerned. But now there are tapes that you can buy from Amazon very inexpensively, and they're clear and they're not very unattractive, that you can actually put around your lips at night that prevents the mouth breathing, that will help with the snoring and everything else. We are in an environment, we're not, like yesterday, I'm a farmer, so we are a farmer, my husband and I. So yesterday I was with my hat in a nature where there's no Wi-Fi within 20 miles or 20 acres around us. There's no Wi-Fi. We're in nature breathing. We're breathing clean, fresh air. But the moment you come to this world that we are driving, every street has 20 cars driving at the same time. We have so much toxins in the air. And if we're breathing to our nose, we're able to filter all those toxins. But if you're mouth breathing, we're taking everything down from our mouth to our lungs. And that's where all the pulmonary issues and health issues arises. So teaching the proper nasal breathing have to start at very young age. We're looking, I'm really want to target 3-year-olds. 3-year-olds can listen, and we can start now with these attractive tapes that they have at Amazon. We can actually, while they're painting, practice nasal breathing and put a tape on our mouth, put a tape in their mouth, and say, let's do painting and let's practice nasal breathing. So it doesn't look odd to the child that they have a tape in their mouth. And these are clear tapes, little X's, that if you go on Amazon and you put nasal mouth tapes for sleep, you see like now 10 pages of it comes up. Where 30 years ago or 25 years ago when I was pregnant, nothing like that existed. And I was forced for my young child to put a regular white 3M tapes. And that was not very attractive. And I had to put one on my mouth and one on my son's mouth to teach him how to breathe through his nose. And nasal breathing was a big practice in my household. And I really, really worked with them all through their life until they were old enough that they didn't want to listen to me, that we need to do breathing exercises. Breathing exercises. I will tell you, if you want to have a household free of diseases, the one thing that I would want you to take home today is practice sealing your lips and breathing through your nose. The moment we breathe through our nose, we are creating a field of oxygen going through our nasal pathway to our paranasal sinuses. There's hair cells in our nose that filters everything. The air becomes warm when it goes through our nasal structure, goes to paranasal sinuses, and becomes what we call nitrous oxide. Nitrous oxide is one of the most potent gas that we can create to zap any virus, bacteria, or fungus in our body. So people that breathe through their nose, they are not getting sick as much as people that are mouth breathers. So one of the number one fundamental thing is breathe through your nose. While you're breathing through your nose and your lips sealed, place your tongue in the palate. And if your tongue is not reaching the palate, that's when you need to see your dentist to see if they can help you with referring you to somewhere to get your tongue tied fixed. Because the tongue needs to reach to the palate and weight lift. So, and there's practices that we can talk about later. The second thing is make sure that the child, when they're born, are able to be breastfed. Breastfeeding is a very, very important factor for teaching the child to be able to, that hard work that he has to do to create suction with a mother's nipple will put, and he's with the tongue pushing through creating that suction, we're developing the upper palate. And that creates a better lip seal so that when they're not breastfeeding, usually their lips are sealed. So they're learning to breathe through their nose while they have that suction created with their mouth to breathe through their nose. But the bottle cannot provide that.
Right. Wow. It's really impressive. Are we able to retrain ourselves to go from mouth breathing even as adults?
Yes, absolutely. I was one that was mouth breathing, and all my life in growing up in Iran, my parents never were educated about these fields. In fact, these knowledges been around for years, but the last, I would say, 10 years, the books that are written on breathing the jaws, and so forth, have brought awareness to the public that, okay, nasal breathing is very important. Prior to that, I don't think people really cared or knew about that, or practiced it. And both my parents in Iran, I don't remember any of them told me to close my mouth or practice that. So I was grown with same thing that everybody else is with. I was fortunate because the nutrition back home at that time was very, my mom always cooked natural foods. She was always, they called her vitamin woman. So she always added ginger to the food. So we had a lot of good nutrition and vegetables when I grew up. So I didn't have much allergies. So I didn't have crowded mouth, but I didn't have the best developed arch either because I was mouth breathing until my late 20s, when I learned about from Dr. Jim Gray and Dr. Vitzik. When I started my in 1990s, late 1990s, I started learning more about the importance of nasal breathing, about TMJ, about airway. And that time of my life, I learned that, oh my God, I'm mouth breathing and my mouth is open. And that time I started using saline sprays on my nasal pathway and keeping my lips sealed and practicing nasal breathing. And a year after when I was married with my children, that was a big thing because I knew how much that affects their growth and development. And so yes, it does. Learning to put the tongue in the palate. Every time you suction the tongue in the palate, you're actually expanding and creating an opening between your mid-palatal sutures, which allows a lymphatic drainage. So you do that, you put the tongue in the palate and you create a suction. Kind of like you have a little lollipop in your mouth, or a sucker, or you have something that you're sucking in the palate, or the cough drops. It's just using your tongue to do that. And when the tongue base gets to the palate and you suction it and you close the lip seal and breathe through your nose, you're actually developing the arch. So I could tell you that I was more open bite when I was younger, and I didn't have any orthodontic treatment, and my tongue placement has closed my bite. So my bite is so close together now that I don't need really orthodontic treatment to correct it. So yes, as an adult, we can learn, we can change the way our faces look. They've done this on two twins, where one was mouth breathing and one was nasal breathing. It completely transforms your facial structure, your complete immune response. I grew up in Iran and I had big tonsils as a child. I was sick every winter and I liked to ski. So I didn't want to miss skiing, so I would go, and when I had sore throat, both my tonsils were swollen up with, it became infectious, and they had to give me penicillin shot in my buttocks, in my and it was very painful, but I wanted to do that so that I could ski in winter. And growing up now, the last, I would say, at least 3 decades, I have not gone sick, and my tonsils are reduced in size because of, now I know that the reason my tonsils were so overreacting because I was a mouth breather. And when we mouth breathe, all the pollutants goes in your throat, the air goes in there, and it inflames the tonsils. When you breathe through your nose, the air is not going through your mouth. The air is filtered through your nose, and now it reduces the inflammation inside your body.
Someone asked if nose hairs are important.
Yes, it is. Now, I'm not telling you guys to braid your nose hair down. You can always trim the bottom part, but internally we have nasal hair all the way, which filters, which also warms the oxygen.
Why is it important to warm up the oxygen that we intake?
It's cleaner.
Oh.
Our body takes it better, and also it's makes it at a temperature that our body is comfortable with. And then when it goes to paranasal sinuses, when you breathe in here, now it turns that oxygen to nitrous oxide.
see.
And now you're breathing in that pure oxygen that zaps everything and kills everything on its way. So if we had a pathogen went into our body, let's say we're next to somebody that's sick, and somehow a bit of that went, we're getting that nitrous oxide because most of the time we're breathing through our nose, and it's just zapping it, and you won't get sick as much. I promise you about that.
That's true. I have actually gotten sick a couple times this past year, and I've been around Dr. Maryam. She has not gotten sick.
Well, because when I'm listening to her, my mouth is sealed. And I want everybody to practice that, because during the COVID, if you were able to be nasal breather, you had less chance of getting sick. And if you got sick, you got better chance of getting better faster, because people that don't know vegetarian, it's more important today, in my opinion, than before. Because years ago, or if you go to Paris, we were in Paris, and that was a place that I had steak. That was my only steak that I had, because my husband, who grew up in Paris, told me in Europe, especially Paris, they don't let outside meat import inside. So their farms around Paris are providing the meat, the chicken, the beef that they need, and they do not use hormones or hormone additives to let these cattle or the chickens to grow fast, to create more eggs. And there you could have meat, and you would not have, in my opinion, as much as reaction if I have a cow that is grown in US. So some countries banned getting food from outside source and adding GMOs, growth hormones to their foods. Unfortunately, here we're saying that we have organic eggs, but we're giving those chickens egg boosters that are organic. But what is an egg booster? And as a farmer, I can testify that there was a time that we had our chickens being taken care of by a person from the town. We have a farm in Tehachapi, California. For those of you that are familiar with Tehachapi, it's surrounded by mountains. It's a beautiful place to buy your acreage for your family if you're in California and you're watching us, because it's still very inexpensive buying the land there. But we had a gentleman that was taking care of our chickens and our sheep, and he bought these egg boosters that was organic, and he said, oh, these are egg boosters, they're not hormones. And then we were getting eggs, like 2-3 dozens of eggs a week, and we were happy because we thought that they're organic. But then later I read the egg boosters, and I learned that, oh my God, they're adding so much corn in there, and God knows if those corns or those things that they're added in there have GMOs and junk. Why would that chicken have so much egg? And now that we stopped the egg boosters for a year and we're letting him naturally, we're not even getting 1/10 of that egg. So that just tells you that we're in a world that we are producing such mass production of eggs and meat and chickens and salmon, and everything is farmed, and our salmon grows over 5 weeks to a big size where it needs months before it could grow that size. So we're thinking we're eating salmon and it's healthy, we're thinking that we're having, products that are organic, but you really need to look at your source. If you are close to areas that they have farm lives, maybe you could talk to them to see if you can get, if you want to be, if you are non-vegetarian, then maybe you have better source. But regardless of that, one of the things that you can control is the packaged food that are in every grocery store across the US. You need to start looking at those packages. You need to read. And if there is more than 5 to 6 items written, don't buy it. If you don't know what it is, look it up. A lot of the products are soy, lecithin, or you could read there's like things in there that are GMOs, that they're oils that are cancer causing, food coloring that could affect your brain function. We need to cut that down, because we are now consumers of I'm going to go to political. It's a capitalistic country where it's all about end money. Really, it's not about our health. is really not about our longevity of life. You really need to do this on your own. It's not something that you are able to just pick and say, okay, I'm in France, and the government has the health care that is for free, school system is for free, and they want me to be healthy as a mother so that they don't have to pay for my sickness. We're here buying private insurance companies, we have the pharmaceutical companies. So the sicker we are, the richer those companies, they're more profitable. So please keep that in mind, that it's all you doing things in your due diligence for your family, and nutrition plays a big role. If you don't want to spend $6,000 to $8,000 on orthodontics for your children, at the age of 3, practice nasal breathing with them, give them more wholesome nutrition, let them teach them how to chew with their lips sealed. These are all learned behavior. They're not behaviors that are like inherited. It's a learned behavior. We have to take the time, and then that would make us even healthier and better. So there it goes.
That's really important, because you know what? Orthodontics is not cheap. It's very expensive. And if you know that there are ways to help prevent spending those thousands of dollars on your child for orthodontic needs, and I'd also like to say something. She didn't talk about this, but she shares a lot of preventative measures with her younger patients, the children that come into this office, because Dr. Maryam practices orthodontics, and she teaches them preventative things to help them to not have to get braces when they get older. And I think that says a lot about Dr. Maryam, for one, because she could easily not do that and then let this child's palate, grow in a disturbed way, which would be more profitable for her, because orthodontics, like full braces of treatment, is a lot more expensive. But yet it really just shows how much you care about people's health, how much you want other kids to actually grow up the right way. So she helps prevent that, and hopefully if you're not in the Los Angeles area near the South Bay, I hope that you can find someone that shares the same practices that Dr. Maryam does.
Oh, thank you. So yes, prevention is as a mother of 2 and as aunt to many, my passion is for children to grow healthy, and my passion is for children not to need orthodontic treatment. If we could get in early on and teach them the nasal breathing, give them the chewing patterns that they need to have for their proper jaw development. At night, supervise them, maybe even help them with the tape in their mouth at the beginning stages. But we have to put for us so that they don't think that that's an odd thing, and say, let's do breathing exercises. Mommy's putting a mouth tape. Let me put a mouth tape for you so we can both practice breathing through our noses, because people that breathe through their nose, they live longer. They live a decade longer. Wow. So we need to do those practices early on. And if we come and we have an 8-year-old that already has crowded mouth, they already sucking on their thumb, or they already biting on their clothes or their blankie, and they're forming an open bite, let's get them to a proper dentist who practices proper functional jaw orthopedics, meaning giving the tools to the kid with orthopedic retainers that allow those jaw develop so that the teeth have room in the palate and the lower jaw. I am totally against extraction. Extraction of any permanent teeth will cause your airway to close, so you're choking that child and you're creating TMJ for those children forever. I'm a big advocate of non-extraction, development prior to extraction. So please, 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 if you're a mother, if you're planning to be a mother, keep this in mind. Practice nasal breathing, practice eating proper nutrition, chewing your food. Go back to raw again, raw nuts, raw vegetables that require more chewing. When we use our jaws for chewing, for developing our jaw and muscles to be in a very good proportion. When we don't use our jaw and we're breathing to our mouth, and now we're clenching all day long. Why are we clenchers now in this society? Why today we have more clenchers and grinders than before? Because of all the allergens in our food, because of our airway being tight. We are holding that spot all night long by clenching, and when we clench, we're using a muscle that we shouldn't be using, and we're growing that muscle, and that is the backward movement. It's holding our jaw from developing the right pattern. So it all goes back. It's just really a bad cycle. So we need to make sure that we are now we're not going to I'm not going to go off the rail, because I'm easily can be disturbed going another pattern. But let's focus on today. When you go to your cabinets, look in there and throw out all those cereals that have so much sugar. Please, Kellogg's and the Nabisco and Mills or whatever those companies are, they really are not thinking about our health. It's fine. If somebody wants to choose to eat those, great. But if you're here to learn foods that have white sugar, foods that have white flour or bleached sugar are very, very harmful. I mean, it says on it. I mean, I don't know. I don't want to eat bleach.
Sometimes some food labels even give you like a warning, like this may cause like something down the line, like
oh my gosh,
there's
right,
like that. They're giving you the warning to like protect themselves, but it's like we still ingest it for taste, right?
Yes.
People are addicted to sugars now.
It's not the taste. Sugar is a drug, and it affects your brain, and it's exactly what it is. Sugar is a drug. If you don't have it, it's like caffeine. If you don't have it, you're slow and your body needs it. And imagine your body has these bad Pac-Mans, if you remember Pac-Man game. It has these bad Pac-Mans that they're looking for sugar. Their food is sugar and white flour. And that's how they feed, and they become microorganisms that are bad for us and make us sick and make our gut sick. If you're not feeding them the sugar and starving them, they're sending transmission of, they're ordering your brain, give me sugar, give me sugar, give me sugar. And then that kid or that adult is looking at every drawer like a drug addict, like an alcoholic, and looking to see what can they eat to get that boost. So let's starve those bad Pac-Mans. Let's give ourselves like fasting. Fasting is a really good way to start. Let's start like starving them and destroying them and feeding them healthy food. Let's close our mouth and breathe through our nose so that we can get the nitrous oxide add in to our equation and boost our immune system even further.
Wow. That just reminds me that I will be ordering mouth tape today from Amazon.
I keep telling you I'll bring you something today.
To practice more nasal breathing, because like I've known Dr. Maryam for several years, and she has preached this for a long time, that nasal breathing is very important. And I think it wasn't up until these past recent years that I really started focusing on it. And I will say that I have improved drastically with it. I focus more on nasal breathing. It also just calms me down a lot more. There's a huge difference between taking like a deep breath in from your mouth, like as opposed to taking a deep breath in from your nose.
Huge
you feel
difference.
A lot more relaxed when you actually take it from your nose.
Absolutely. Please practice today, sitting on your desk, closing your lips, and do 10 deep breathing. I know that's like a yoga breathing, but we need to practice that in our daily life. When you're behind a computer, put a little sticker on your computer, say, keep your lips sealed. This was the thing that we did in my house. When the children were young and when I was driving and I look in the mirror, their mouth is open, all I had to do, have a signal, and they both knew that means let's close our lips. Because I really made them understand that, do you want to live longer? Because in reality, the research shows people that are nasal breathers live longer. I do for sure.
Yeah, she's gonna live a long good
life. Okay, let's knock on the wood.
Juliana. Hi, Juliana. Juliana asks, I need advice on any products for gaps. I would assume like gaps in the teeth, right?
No, the gaps on your teeth is the process. When we have our front teeth have gap, that should tell you, if I'm in a restaurant and my waiter has a big gap in his front teeth, that tells me that his tongue is all night long trying to find space and is pushing and creating that circumference to be able to survive. If we close that gap without taking care of the other problem, your gap's going to open up again. So if I knew you and I would have your pictures, then I would tell you what practices to do. One thing that I would say is keep your lips sealed and your tongue in the palate. So instead of your tongue at night pushing and opening your mouth, if it learns to be on the top palate and you put tapes on your mouth, it will calm everything down. And it's not going to be overnight. We're looking at months before we can see the result. But that is one way of not increasing that gap.
I've seen a lot of people that have had braces and their gap closes and then afterwards their gap opens again.
Yeah, because that's what, when we're in a country or a world that we only want to treat the symptoms. We don't want to go and underlie and find out why is that problem arising. I've always been Sherlock Holmes in health. And if a patient comes, our consultation is usually 1 hour, and I sit and I listen to everything they have to say, and I look at all the things they're taking, and I pay attention to everything that's going on to be able to fully have equipment to help them and figuring out where that problem comes from. Here we are like symptom treated. Okay, so let's put braces and close that gap. But if I didn't teach you proper tongue placement, proper lip seal, figure out why your tongue is all night long opening, maybe your airway is closed, maybe we need to move your jaw forward to open the airway to be able to calm the tongue out. So these are things that we should look in when the children are young, not when they're older. I mean, if we can always do it at older age, but if we teach the children the right patterns and the right habits and the right nutrition, they will never need to have orthodontic treatment. And if they do, it's very mild.
Juliana said that she can't really breathe through her nose. So what are some tips on how to become a nose breather?
Yes.
And she has a lot of allergies, and she says her parents have told her that she's had it since she was young.
Yes, so that comes from when you were young, in your growth and development, there were allergens in the food source that you've taken that created that mouth breathing pattern. And in order for us to be able to fix that, just remember, my nose were clogged all night long, but I've taught it to open up. And how you do that is you need to either mix yourself, and I have one, is the video in
it's on TikTok and on Instagram.
I have this video on TikTok. If you go to our TikTok under BLAfit, BLAfit TikTok, you will see the video that I made that you buy a nasal spray, salt water, or you can buy it from any health store, or you can buy it from drugstores, and they're nasal mist sprays. Because you'll be mouth breathing, your whole nasal structure is dry. So you have to first introduce moisture in there and get that kind of like a car that's been sitting in a garage for so long, we haven't used it, we need to warm it up. So we need to warm up our nasal pathway, and by introducing the nasal mist or mixing your own nice saline liquid, which is with each 8 ounce of water, 1 teaspoon of sea salt, you mix it, and that water should be boiled and then let cool down, and then you mix the salt in there, and you can keep it in a mason jar by your bathroom where you brush your teeth, and you can rinse your mouth with it to get better gum health. And you can also put, after you wash your hands, put a bit in your palm of your hand and sniff it up. And it's going to at the beginning burn the nasal pathway, but it becomes easier and easier. Once you do that, then you blow out on a tissue, you get out all the mucus that's been dried up in there. You need to do that several times. Then you can close your mouth and practice breathing slowly through your nose, and you will be able to moisten that pathway and get that rolling. the inflammation in your nasal pathway will reduce once you breathe through your nose. So you got to practice that until you reduce the inflammation in your throat, into your nasal pathway, and it's a learned behavior. But you have to start slow. And I did that, and I testify that I started this later in life, and I'm capable of breathing through my nose. Even though I'm able to breathe through my nose, I'm a big believer of nasal strips. In fact, I've talked about that to my patients so much that those nasal strips on Amazon are hard to find now. There's nasal strips that are pediatric nasal strips that does not harm your nasal skin, and it's hypoallergenic. You put it on your nose, it lifts your nose, and it makes it easier to breathe through your nose. They are an orange package, and we can actually have Natalie on Amazon. Maybe next time we bring it, Amazon sells it for $3 something for 12 of them. So that means 12 of them, that means 12 is 7 days. So almost 12 days, you're paying $3.95, which is not bad at all. And sometimes they have sale. And it's a company that is not Breathe Right. It's a Breathe Right from Turkey that sells it cheaper, the pediatric size. I've learned this because I've been using nasal strips for now almost 2 decades. Have not missed one night without it.
Wow.
If I don't have it, I'm like an addict looking for it because it helps me rejuvenate myself. If we can practice nasal breathing and make it easier at night when we're sleeping, to breathe through our nose is anti-aging, is anti-sickness, is beautifies your facial structure, improves your immune system. Why not? If it's going to cost me pennies to do it, I'd rather make my coffee at home and buy that to be able to afford that, to be able to have better life and better quality of life. I am 55 years old. In the last 2 decades of my life, if you look at my pictures at my wedding 25 years ago, and you look at me today, I probably look better today than 25 years ago. I have my photos in my house. People come and they say, oh my God, you look the same. I look at myself, I feel like I look better. My facial structures look better because now I have a much more pronounced cheekbones. Well, that's because I do face yoga and exercises. But one of the main reasons that I'm fit without too much exercise is breathing through your nose. When we breathe through our nose, we're actually improving our weight. We're actually we're improving our metabolic activity. There's so much more than just zapping the pathogens. So nasal breathing or meditative breathing are really good for overall health, and we need to really implement that to our children. We're going to yoga classes, we're learning it, but what about our children? We need to, as parents, take the time and teach our children, our nephews, our brothers' kids, how to breathe through their nose, and teach them that if you breathe through your mouth is going to be crowded and you're going to live shorter. Don't you want to live longer? And make them understand why, and teach them about the sugar product. When my children were young, I was telling them, do you know this bleach I'm putting in the bathroom? And they said, yeah. I said, do you want that in your food? And they said, no. And I said, that's what they add to these candies. That's what they add to these cereals. And mommy's gonna buy you cereals that are healthier and food that are healthier. And they understood and they didn't have craving. So now that they're in college, I don't know, but at least through their growth and development ages, that's what we did. Another food in candies that you want to avoid children to have is colored candies. The color that they add to these candies, they say is food color. I promise you, they have lead in there. I promise you, they disturb the brain activity for these children. They become wild. If they have already some sort of ADHD, it's going to make it worse. Please avoid color food, color cereal, color candies. Look at them. If it says red 40, throw it out in the trash. That is basically a drug for their brain to make them the stimulation higher, to make them wilder, to make them more adjective. So you don't want to do that. Please do not. They're all chemicals, like the colors that we paint our walls. They're just called food so that we don't die because they put a small amount, but it is very harmful. So anyways, they should be illegal. They should be illegal.
They are illegal in other countries.
I don't know why. I don't know why here we're allowing things that disturb our brain, cause diseases, cause cancer in our food, and we are allowed to give it out and put a little disclaimer on the bottom that nobody reads. But then yet there are other products that are really good and healthy we're banning because the advertisement says libido is enhanced. You know what I mean, right?
Mm-hmm.
So anyways.
Juliana asked that they are in school for like healthcare pathway, and they just wanted to know what your title was. Well,
my title
Yeah.
of what I do,
Mm-hmm.
I'm a general dentist, board certified general dentist in California, and I have a diplomat, board certified in craniofacial pain with American Board of Craniofacial Pain. I'm board certified with American Board of Sleep Medicine, and I'm board certified with International Board of Orthodontics. So, and I consider myself a nutritionist because all those board certification had nutrition aspect to it, and I love nutrition, so I've read so many nutritional books that I can practically pass a board for nutrition. So I'm all about nutrition. I teach it to my children in my practice. We talk about it with my patients. So nutrition is a big part of our overall health. So I don't have a title, but I'm just somebody that loves your well-being, loves my children's well-being and my family's well-being and my staff's well-being, and somebody that cares.
Yeah, she does. She has a really big heart, and it shows a lot every day. I'm very lucky to work with her and be with her all the time.
I know.
She's
I
very
am
inspiring.
lucky to have Natalie across from me because she is an inspiration to me to see a 23-year-old young adult, so mature, so aware about her health, and so smart. And she doesn't even know when our desks are across from each other. And I've seen her grow so much that last year she's been with me, where I see her now 5 hours sitting on her desk with her lips sealed, breathing through her nose calmly, like meditatively, calmly working. And if we can increase that in our workspace, at your workspace, breathing through your nose, realizing life is short. Why are we rushing through everything? And it's sad because unfortunately we're in a country that we don't have job security, and it's easy for me to preach that because I knew that, and I always wanted to be my own boss. Even when I was younger, I didn't want to work for other people to tell me how to run. In fact, when I finished dental school, I worked a short part of my life at a dental office, and I realized that short part that the dentists that I worked for them, they were telling me purposely to make a tooth to have root canal so that their end money of that day production is increased, and I couldn't do that. And I'm very, very non-invasive. Sorry about that. I am fasting and I just had coffee, and it's like I'm getting excited. I am against invasive in any aspect of my life, and imagine coming as a dentist to this world and wanting to work and experience being a dentist, and somebody telling you a feeling that's very conservative, you need to make it to become a root canal. So this is what the world we're living in. And I couldn't last in that place because I was speaking up, and I've always been outspoken. Throughout my life, since I was in high school, I was always in trouble because I led a revolution in my class. I was always speaking up for my rights, for people's rights. So I'm always in trouble, and I'm in trouble right now in my town, emphasizing on non-extraction, orthodontics, nutrition. So there's a lot of practitioners around me that love what I say, and there's a lot that don't like what I say, and I don't care. My goal is to get one child one kid, one adult in a better life, and that's rewarding enough for me to be able to do all of that. But what I'm saying is that I don't know. See, I went tangent. So I couldn't last working for somebody else. So at that time, I learned early that I need to work for myself. I can't have people tell me how to do it. And I was one of the most conservative general dentists that exists, because if I had a child that had cavity, I would go with the smallest burr and I would make a small lesion and I would feel it so that it's not a big feeling. And I became very, very popular that first year of my dental practice, and then I stopped general dentistry and I started doing orthodontics, TMJ, and sleep apnea, because that really in tunes with my belief a lot better than me just shaving teeth, because I believe if I could prevent cavities in general, cavities were non-existential 100 years ago, when we had in the villages that had natural food. Even today, if you go to northwestern islands and people that don't have the packaged food, they have 0.03% rate of caries. They don't have cavities because they don't have the westernized junk added into their food. They're eating natural, wholesome food. Food from Mother Earth does not create cavities in your mouth. All the processed junk creates cavities. And for me, my role, it's much more than sitting and feeling cavities for people that they want to eat junk. I rather preach healthy eating to people and preventing cavities than sitting and drilling. So for me, prevention is a big thing. And one of the things that I've invented is called BLAfit appliance, and it's an exercising device for the mouth. It is also prevention for aging, prevention for TMJ, prevention from clenching. I'm all about prevention. I'm all about all of that. So I got excited and I went down. I'm going to let Natalie speak a little bit.
Great.
And I think we're past our time now.
Yeah, we're coming close to, we have to wrap it up. But Wendy said, hi Wendy. Wendy said, I always enjoy listening to you both. Thank you.
Wendy.
I'm mostly here just listening and taking in absorbing all of this wonderful information that Dr. Maryam shared.
So let's wrap up what we learned today. In this class today, we learned number 1 is nasal breathing.
Mm-hmm.
Breathing through our nose. Let's practice during the day. Let's enhance it at night with a mouth tape. For my Amazon watchers and Amazon Live, Amazon has very inexpensive ones. There's one brand specifically that's clear, like an X, but it's clear. There are 120 of them for $8. So that means almost half of the year you're having for $8. Putting a little tape in your mouth at night to increase your nasal breathing at night, slow down on snoring, and it's just enhancing the oxygenation to your body, improves weight loss, improves metabolic activity, and all of that. So first thing is nasal breathing. The second thing is nutrition. Let's use our teeth for what it's made, chewing. Let's not juice all of our food. Let's not make shake all day long and drink it because we don't have time. Let's take a time during the day and really sit down with no distraction and chew. And one person that's really big on that is this young lady sitting next to me. I go to lunchroom. She's really taking her whole hour chewing a plate of food because she's using her muscles of mastication for chewing. Let's chew our food, at least one portion of our meal. Let's sit and do some raw nuts and healthy vegetables that require chewing, carrots that are raw. Let's chew. Chewing will produce right pattern. Now remember, when we're chewing, let's keep our lips sealed. Let's not chew with our mouth open. Mm-hmm. Let's lip seal, and chew. Now, we are forced to breathe through our nose when we're doing that chewing. 35 chewing for each spoon that goes in there is what it requires for better digestion, for better absorption, for our salivary glands to produce all the perfect enzymes to digest what we're eating. And then third is, let's stay away from all the toxins in our food. So chewing and then away from toxins in our food. Let's get rid of the white sugar, white flour or bleached flour or bleached sugar out of our daily life. If we can become gluten-free, perfect. Get to better sources of food that are less items in your food packaging. I don't use any packaging in my house. We've thrown all the packages out. The only one package that I do still use is not packaged. It's packaged in somebody's home. It's a homemade cereal that are with nuts and some oats in there. It doesn't have much granola or anything like that. And I used to make it at home, but I didn't have time. But minimize your packaging, minimize your processed food. Learn to meal prep for yourself, care for yourself. Take away from the time you're on social media and really meal prep for yourself. And enjoy your meal, breathe through your nose, and I love you all.
Oh, such a wonderful message. Thank you everyone so much for joining us. I know I really enjoyed listening to everything you said. I was like, wow, I need to practice all these things.
You already do some of them, so.
A good chunk of them. But, there's always room for improvement. But anyway, we'll be here next week as always. Every Monday we're here talking about something new. So if you guys have topics that you want us to talk about more or you want to learn more and want Dr. Maryam to expand on, please let us know. Wendy said, I've taken mental notes on many of these recommendations. You're appreciated.
Thank you.
Oh, we appreciate you for tuning in with us and listening to us. As always, have a wonderful week, and we'll see you here next week. Ooh. And now...